These are my 30 sentences for learning activity 9. This is chapter 7. I met a man who was diagnosed with anosmia, which means he has no sense of smell anymore. Anosmia. The disease aphonia is really devastating because it stops you from being able to speak. Aphonia. My friend has a bad case of bronchitis, so the doctor said he was advised to have a bronchoscopy to see what was really wrong. Bronchoscopy. A classmate of mine had a bluish discoloration on his skin. He was later diagnosed with cyanosis. Cyanosis. When people have empyema, they start collecting pus in certain cavities in their body. Empyema. People quietly breathing or breathing normally is called eupenia in the medical field. Eupenia. You may experience hypernia when you run at full speed for an extended amount of time. Hypernia. Hypoxemia is when you do not have enough oxygen in your arterial blood. Hypoxemia. Whooping cough, otherwise known as pertussis, is very preventable if you get the vaccine for it. Pertussis. When I get a cold and have to spit, I am usually spitting out phlegm or mucus that is in my chest. Phlegm. Okay, this is chapter 8. Anorexians are basically drugs that are made to stop you from having an appetite. Anorexians. Many people who want to lose weight end up having bariatric surgery to help them achieve that. Bariatric surgery. If you are having trouble digesting your food, you may be experiencing bradypepsia. Bradypepsia. Some people with colon problems end up getting colostomy bags in order to help digest their food. Colostomy. If you eat any type of food with bacteria in it, you may start to have diarrhea and experience enteritis. Enteritis. Polyposis can be a very deadly disease because it makes you develop multiple polyps, which can lead to cancer. Polyposis. There was a person in the hospital that was dealing with proctoptosis, which meant that their rectum was sliding out of place. Proctoptosis. The ileum needed to be moved to a different place in the abdominal wall, so the doctors advised the patient to have an ileostomy. Ileostomy. My mom was very interested in the structure of the teeth when she was younger, and that is called periodontics. Periodontics. I was having deep pain in my upper right tooth, so I went to the doctor and he told me I probably had dentalgia. Dentalgia. This is chapter 9. Having a lithotripsy is a good way to help remove kidney stones from your bladder. Lithotripsy. People experiencing pelvic pain may have an infection in their bladder or kidneys, also called cystitis. Before starting your new job, the employer may ask to take a urinalysis to check for drugs in your system. Urinalysis. The doctor my friend went to studied nephrology in college and got his degree in it. Nephrology. Doctors may do a metotomy to help relieve a patient's pain in the urethra and meatal stenosis. Metotomy. Chapter 9 has mainly focused on the study of the urinary system, which is called urology. Urology. If the doctor wants to check inside your bladder, he will perform a cystoscopy on you. Cystoscopy. Hemodialysis is when a person has a dialyzer that assists them in removing waste from their body. Hemodialysis. A meter that checks how much gravity a person has in their urine would be called a urinometer. Urinometer. People with urine problems may be advised to undergo a cystography so the doctor can visualize what is going on in their bladder. Cystography. And that's it.